A WSU student is dead.
And now his family wants everyone to know why. Well, that WSU student was found unconscious in a dorm room last weekend. He died of respiratory failure brought on by acute alcohol poisoning.
Whitman County Coroner's Office says 18-year-old Kenneth Hummel had a blood alcohol level in excess of 0.40. That's a lethal amount that caused him to stop breathing. And today, Hummel's family said energy drinks may have contributed to the freshman's death, and they want to warn other families about the dangers of blending alcohol and high amounts of caffeine.
The problem with these energy drinks, which are highly caffeinated, is that the person who drinks one and alcohol, and too much alcohol, is that their body doesn't shut down and they can drink alcohol past the point that the body can handle it. And like Kenny, the person dies.
Today, WSU officials thank Hummel's family for calling attention to the risks that students take when experimenting with alcohol and say the student's death is a sign they need to redouble their efforts to prevent binge drinking. That's where KXY4's Jeff Humphrey joins us live with more on this problem. Jeff?
Like WSU officials say, it's the doctors at Pullman Regional Hospital who keep their finger on the pulse of the university's drug and alcohol problems. The data provided from the emergency room suggests that the students who are choosing to drink are drinking more heavily than before. Kenneth Hummel had only been a WSU student for 3 months, but in his newfound freedom, campus police had already charged him with being a minor in possession of alcohol. Then last weekend, in a different drinking incident, Kenny was found not breathing in his friend's dorm room.
We got there, we took over the CPR until Pullman medics arrived. They treated him, transported him to the Pullman Regional Hospital, and he was pronounced dead at the hospital. When
WSU police searched Kenny's dorm room, they found several empty bottles of 5-hour energy drink that's sold here on campus. Now the school and Kenny's parents worry high doses of caffeine kept Kenny from passing out and allowed him to consume a fatal amount of alcohol.
Alcohol is a natural depressant, which makes somebody either go to sleep if they drank too much, if they drank some. The energy drinks will keep them awake so they can consume more alcohol than maybe they would have.
Here at Pullman Regional Hospital, emergency room doctors have treated 4 students so far this semester for acute alcohol poisoning. So much booze, the patients had to be put on ventilators because they otherwise would have stopped breathing.
What we are finding is that the number of those incidences have not increased over the years, but the level of severity or the blood alcohol levels have increased.
University officials don't know if they're seeing an increase because students are finding hard liquor easier to get, but they plan to find out.
The president has decided that a blue ribbon panel is necessary to really coordinate our efforts and to make sure that we're using best practices in every way.
Hospital officials want students to know that if one of their friends loses consciousness because of drinking, it's time to get them to the emergency room. Doctors there pledged not to release the names of their drunk or drug patients to law enforcement or the university. Reporting live at WSU, Jeff Humphrey, KXY4.
Thank you, Jeff. Now, according to the Centers for Disease Control, drinkers who mix alcohol and energy drinks are 3 times more likely to binge drink. Excessive drinking kills nearly 80,000 people a year, and binge drinking is associated with health and social problems, including drunk driving, violence, and risky sexual activity.